Hello, everyone. Thank you for joining us this afternoon to discuss the hidden costs of delivery fees. My name is Ruth Whittaker, and I'm the Director of Civic Innovation Policy at Chamber of Progress, a tech industry coalition promoting technology's progressive future and ensuring that all Americans benefit from technological leaps. I'm excited to be joined today by Ronza Othman, President of the National Federation for the Blind in Maryland, and Ansley Fellers, Executive Director of the Nebraska Grocery Industry Association. We will also be joined later by Councilmember Blegay from Prince George's County Council. She's tied up in a meeting right now, but will hopefully be joining later on. Before we get into the discussion, I wanted to provide a little bit of background about what delivery fees are and where we're seeing them. In 2022, Colorado became the first state to implement a 27-cent fee on deliveries by motor vehicles. The fee applies to traditional and e-commerce deliveries, as well as restaurant orders and grocery deliveries. In 2022, Minnesota followed suit, implementing a 50-cent fee on many categories of retail orders above $100. Other states, including Maryland and Nebraska, have proposed similar fees but opted not to implement them after opposition from a diverse coalition of advocates and business groups. Proponents of these fees often point to growing budget deficits and the need to find alternative revenue sources, while opponents, including us here at Chamber of Progress, argue that they are regressive taxes that hurt consumers, delivery workers, and small businesses. So with that, I'd like to turn to our panelists. And Ansley, I'll start with you since Nebraska was the most recent of the states represented here to consider a delivery fee. So your organization opposed the fee that was proposed during the special session over the summer. Can you tell us about how grocers use delivery services and how the extra fees could impact grocers from a business perspective?
Sure. So I think most people are probably familiar with, the third-party delivery services. So a lot of our grocers, especially our independents, I would say not especially, but including our independents, partner with third-party delivery services to get their groceries to folks, especially coming off the pandemic. That is a consumer demand. A lot of people expect that to be the case now, and they expect it whether it's your hometown grocer or a larger sort of retailer in an urban area. And I will tell you, I think maybe one of the most surprising things, or something that folks don't think about when they're talking about increasing fees and sales taxes, is that yes, they're regressive. The one positive thing, I suppose, if I could pick it out, is that they're transparent. At least you know that it's being imposed by the government and not the business. But that's the only nice thing I will say about them. But they are also it just puts our small and medium-sized businesses at further disadvantage, right? So those businesses and a lot of the people I represent have to pass those increased costs along further. So they're already paying higher input costs than their large national, multinational competitors. Anytime you increase the sales tax, anytime you insert a delivery fee, those businesses they're forced to pass that along faster, making them even less competitive than they are. And this grocery is a highly, highly competitive industry. So is restaurant and other types of retail. So, we're looking to keep costs low on every front. And this is just another sort of, I think, ding to those small and medium-sized folks. The big guys didn't love it either, obviously. Again, it's just going to have to be passed on to consumers in many cases, but some of them could absorb it for a while versus I know our small businesses were just looking at it as another unfortunate consequence in having to raise prices for their customers.
On that note, like you said, most businesses are not going to be absorbing these fees themselves, particularly the small and medium-sized businesses who just have tighter margins than the sort of larger conglomerates. So looking at it from a different angle, how do you see delivery fees affecting consumers, and particularly in the grocery space, what impact could they have on food access?
So I think that I don't want to jump ahead to another question, and maybe we'll get into this. And I think probably Ronza has a really good perspective. I think that there is a sense sometimes, maybe from policymakers who have in Nebraska, in some cases, we have policymakers who have actually been removed from the grocery purchasing for their family for quite some time. And I think that's maybe not entirely uncommon to see folks that have been, kind of either have grown kids or who maybe haven't been involved in those decisions. But sometimes there's this perception when it comes to services like this that it's maybe a wealthy contingency, that the customers that are using these services are wealthy. But we obviously, all of us were here because we know that's not the case. That's not always the case. A lot of times it's folks who can't otherwise get out. It also happens to be low and middle income families, right, who are the most strapped for time. And coming out of the pandemic, like I said, folks are sort of saw getting groceries delivered as wouldn't it be great if I can get off work and go home and have my groceries there and start dinner and spend time with my family versus having to make that stop between. I know, and I'm talking from not just anecdotally from experience, but that's how it's bearing out. So I think sometimes there's this sense that those who can most afford it use this. Really, we should be making sure that everybody can continue to afford it, especially because it's food.
Absolutely. And that's a great segue into my next question. So Ronza, the National Federation of the Blind, spoke out against a proposed fee in Maryland this year. Can you tell us about why your organization got involved and particularly how delivery services have affected and worked with the blind community?
Sure. Thank you so much. This is a really important issue for the disability community, and I'm just going to put it in give a little bit of background to put it in context. Currently in the United States, people with disabilities have an unemployment rate of over 50%. My constituency, people who are blind or low vision, have an unemployment rate of 73%. So think about that. 50%, up to 73% of people in this country who could work and want to work are not working, either because of their disability directly or because society isn't kind to people with disabilities necessarily in their negative stereotypes about employment for people with disabilities. And so when you look at that, you look at how are these people surviving? Well, they're largely surviving because of fixed incomes, because of social welfare programs like Social Security Disability or SSI or other kinds of supports while they either get on their feet or work to improve their situations. They depend, because of their disabilities, many of them, on food delivery options, grocery delivery options, and sometimes restaurant delivery options. Think of the individual who has, during the pandemic, cannot go out to a grocery store because they are immunocompromised, or cannot necessarily get to a grocery store easily because they are using a wheelchair and you need public transportation, and the amount of transportation options that were out there have completely diminished or decreased in significant ways for people with disabilities generally. So many different bus systems are cutting bus routes, and those that are taking public transportation can't get to grocery stores anymore, or they physically can't because of their disabilities. And so if you think about those individuals, fixed incomes combined with the absolute need to have their groceries delivered because of lack of transportation or food deserts or whatever other factors there happen to be, adding this cost, this charge to them, it's essentially a disability tax. It's not equitable. It's not absorbed equally among all segments of society. And it's essentially targeting the most vulnerable population who needs that food resource very desperately in this way, right? It needs to be delivered. It needs to be brought to them. I'll just say one other thing, and I know the councilman would like to get in terms of the people like me and my constituents. If I go to the grocery store, I have to take my time. I have to ask the store personnel to help me shop. I am taking somebody off the floor or off of a register. It's much more efficient for me and for the entity to actually be to to do the shopping and then for me to use a food delivery service to have it come to me. Council member, I apologize. So, but when you add that fee, you know, to something that was supposed to make my life better, easier, it doesn't make it easier. It makes it harder, and it's a tax that I have to pay that it's going to be disproportionate to me and people like me and people with disabilities who we represent the communities that really can't afford it in the first place. This pass-through charge is more than we can manage, and it's not fair, and it's disproportionate because we don't have other choices. We can't just jump in our car and go get our groceries ourselves, or jump in our car and go get carry out and bring it back home. We don't have that flexibility like other populations do, and so it is disproportionately aimed and harmful to the disability community, the delivery fees.
I really appreciate that perspective, and I have a couple follow-up questions for you as well, Ronza, but I want to recognize Councilmember Blegay from Prince George's County, who's able to join us, and I know that you have a tight schedule this afternoon, so happy to hear any thoughts that you have on delivery fees as well, Councilmember.
Thank you so much for giving me an opportunity. I do apologize to all of you all that I will not be able to stay on long. I actually in the middle of a committee meeting that's gotten quite heated, and I have to address the concerns of my community, which comes first. I do want to note I'm Councilwoman Blegay. We're council member from Prince George's County, Maryland. We have about 1 million residents here. I am so glad you guys are talking about this issue. This is something that is plaguing our community. Prince George's County, we have quite a few, we have about 25% of our population are seniors. But we don't have a downtown center. So right now, we don't have very many walkable communities in downtown centers. This county was built with sprawl for almost 40 years plus. It was farms that were turned into communities. So we don't really have walkable communities. So what that means is that our senior community has a really difficult time aging in place. They oftentimes have to, we're trying to start building around metro stations. I remember almost 15 years ago, that was like a big thing because around metro centers, there really wasn't very much of infrastructure around them. But we haven't quite done that yet. We did put a plan together to do that. But the point is, right now, we have not done that. So we have our growing senior population and also growing those persons with disability. And what we have is that they're in places where it are not walkable. So they're not able to walk to grocery stores. They're not able to walk really anywhere. We are trying to build the downtown centers. We haven't done it yet. So we have a bus system, but the bus system is very limited in where it goes. Mostly it goes into the District of Columbia and back, but going throughout the county is difficult. So what we find is that our seniors are actually very frustrated because they don't have an easy way to get to the grocery store. But because of the high fees of just using all of these apps, and honestly, some of it has to do with even having the phone service that allows you to easily use them. Some of them are having a difficult time using them, which means that we have a lot of food insecurity issues. This is a major issue for us of making it easier. We are trying to do it by building more walkable communities so that our senior and persons with disability can easily maybe get to a store. But until then, we have the overarching problem here in Prince George's County. So actually addressing these fees would help address the concerns of our residents because our residents are on fixed income. I can give an example. We were supporting a lady in my district that she has a home. And frankly, with the stairs, there's two ones. One, she has her check from Social Security is $1,265. Her mortgage, which she still pays, is $1,100. So she only has about $165 left, and that is supposed to go for food, utilities, and any other expenses that come on. So the reality is that she has a very difficult time getting access to additional money for food. Any cost of like having to actually pay for like any of these, if she did Uber Eats or any of those apps, she could not afford it because even $35, $25 takes from the food that she needs to feed herself for the entire month. So we do have constant issues with that. We also have, there was another lady that we discovered in our district where she lives in a place that has very high stairs. So because she cannot afford to actually move into a senior facility, because you understand senior facilities now, even affordable housing is up to between 1,500 to 2,000 a month. Many of our residents cannot afford still in their homes that they're paying less than $1,000 or maybe just 1,000 because they're still paying their mortgage or no mortgage. She cannot get down those steps easily. So she has to use the delivery for her groceries. And frankly, she has a very tight budget. So she really has asked us or reached out to us to help her. So we do have those come in. We have a hidden group that's happening. So I do appreciate any efforts that we actually looking at the state legislation that will probably remove these fees. And it's really hard because we're going to get a lot of pushback and we are in a deficit at the county level and at the state level. So we really don't have money to pay for the fees because that will be the option if we do remove them. But I do appreciate all the work people are doing today on this issue because this is a huge issue in Prince George's County. Maybe in more metropolitan areas, there are more walkable areas that people don't have to spend the money. But in Prince George's County, you have to spend it or you have to have a car. And if you don't have a working car that you can get around, then it's difficult. We find that a lot of our seniors and our persons with disabled community rely on Metro Access, which is often sometimes late or costly in itself. So a lot of them are using that to get to the grocery store. So we do need to find some ways to address this issue because we have a growing population that's really suffering and suffering really in silence.
Absolutely. Thank you so much for joining and for sharing that. And I would say, you called this community a hidden community, but I would actually say that it's larger than I think that people understand. The community that sort of faces limitations in shopping in person, whether that be seniors, whether that be people living with disabilities, or people who don't have access to regular transportation. I'm going to show some research that Chamber of Progress has done in Colorado. We commissioned a survey there and found that 20% of Colorado residents needed to have at least some items delivered due to a disability, illness, or mobility issue in a single month. And in general, that those households placed more delivery orders in an average month than people not facing disabilities or illnesses. So, Ronza, I'll turn it to you. Do you think that lawmakers are paying appropriate attention to these communities? And do you think that they understand how large this community is and the need that they're facing?
I don't think that the lawmakers really understand how large the community is or what the overall impact is. And I wish they would think about, what the impact is and frankly, just survey their family and friends. The United States Census, the 2020 decennial survey, reflected that there was between 23 and 25% of all Americans have a disability. That's 1 in 4, roughly. And that's gone up from the last time that it was 1 in 5. And the time before that, it was 1 in 6. So the number of people with disabilities in this country is increasing, not the other way around. And so, each of us has somebody in our lives, or multiple people probably in our lives. What I've seen is that these fees, these discussions in Maryland, for example, as part of the General Assembly's budget deficit reduction efforts in 2024. We'll see if they try to reintroduce it in 2025, but we're hoping they won't. That they talked about it as this is an easy solution. It's just a little bit of money and it's not going to impact that many people. The reality is it's going to impact a lot of people. It's going to impact roughly, at least, disproportionately and in a negative, harmful way, 25% of the population. And that only is the disability population. That doesn't include folks that are otherwise underrepresented or maybe socioeconomically disadvantaged, not related to disability. And so in having conversations with them, okay, it's 50 cents. I heard 50 cents was one of the per order. So I did a quick poll of some of the people that I know who are in my particular disability community, and it's adding up. It adds up with DoorDash and Uber Eats and all the different kinds of groceries that they're getting, of course. And so most people order groceries roughly once a week. Now, some of us order groceries from more than one store. So now you have to pay per store, right? Because I don't have everything coming from one store. So if I'm paying somewhere along the lines of an additional $7-8 a week, probably minimally, and then you're going to multiply that, and that's what, $30 roughly coming out, $30-40 coming out of your monthly check that you didn't have. But then medication is now also being delivered by retail establishments. And so medication, and you're going to get medication when you need the medication. You only get your medication once a month. It doesn't get delivered to you only once a month. It gets delivered to you when it's time to be refilled. In some cases, my little survey reflected some people are getting their medications, 15 times a month. Every other day something comes. And can you collapse that? Maybe, but should you? And would your doctor let you? I know somebody who I asked them to write it down for me. Tell me how many deliveries are you getting that you can't live without? This person had a kidney transplant. They are on 29 different medications. They come at different times of the month. Some of them are monthly, some of them come every 2 weeks, and some of them come a little less frequently. They have to have certain food. And so if they order a particular thing that's supposed to be in their diet from one grocery delivery, from one store, but it's not available there, then they have to try another. They gave me a number of about 50 different delivery experiences. Okay. So that's just related to the medication and the absolute food necessities, not even the fun stuff, not even the I'm going to treat myself to some, barbecue wings stuff. And again, fixed income. And so some people might have 1 or 2 experiences where they have to pay this fee a week or a month. Some people are going to have it almost every day. And I don't think lawmakers have any sense of what the impact is generally on the population, but certainly there's going to be an inconsistent impact, and some people are going to have to pay it a lot more frequently than other people. And so I would urge people in the community and people who are generally just having conversations with lawmakers to point that out, to have these conversations and say, tell me who in your family is going to stop taking their medicine, or how they're going to find an alternative way of getting this conversation. I think some people are starting to get it, but Nebraska just passed this recently. And so the work of the advocates didn't overcome the stereotypical belief that if you are ordering groceries or if you are ordering food delivery, that's a matter of privilege instead of a matter of necessity.
Ansley, I think that this goes to a point that you were making earlier as well, that there may be some misconceptions among lawmakers about how delivery services are being used. Can you talk about either in Nebraska or broadly what you're seeing, if there are other sort of misconceptions or misunderstandings of how delivery services are used that you think would be important to correct for the policymaking conversation?
Sure, thanks. And I think, I don't know, maybe I misunderstood. We did not pass it here in Nebraska. Maybe I misunderstood the end of that. We did beat it
Sorry
back.
about that.
Yeah, no, that's okay. I thought that was what you said, and I thought, no, we did, but it was part of it was a big coalition effort because it was part of a broader increase in sales taxes and fees. So I am genuinely concerned, as anyone should be, that as you narrow down the coalition, if they're just targeting 1 or 2 things, right, we get that gets tougher and tougher. Although then you have the argument, like you were making, Ronza, that actually, and I think Ruth, you said this at the beginning, that then you're really targeting a limited number of people. It's not a very broad-based tax. So we kind of, I mean, it cuts both ways a little bit. I do think, sorry, Ruth, I kind of got off there. I wanted to make sure I mentioned that, but I do think there's a lot of misconception about what these are. I think Ronza talking a lot about other types of delivery. So ours is very specific, mentioning, medication and other things that folks need to get at their home is important. I think all of those things are really important to reiterate, and we will keep beating that drum. I don't know if I answered your question. Sorry.
No, yeah, that's perfect. Thank you. And appreciate the sort of details on Nebraska. It was certainly a complicated special session. So good to have someone who's on the ground with all the details there. One final question before we start to wrap up, but given all the different constituencies that we've sort of heard about today that would be affected by increases in prices for delivery services and people who are really dependent on them, what can those communities do, or people who are concerned about this do, to make sure that their voices are heard by their representatives if these types of fees are proposed in their states in 2025? Ansley, I'll kick it to you first.
Sure. I know the Chamber of Progress understands membership associations are really vital. And I know folks don't always understand or appreciate, but there are membership associations that represent a variety of industries. So any type of professional service or retail you can think of probably has some sort of association that helps them, represents their businesses nationally or at a state level or both. And I would encourage, if you're part of the business community, that you reach out to whatever that looks like. If it's the chamber, if it's your professional association, it is always helpful, I think, to present a united front because there's a variety of these entities. You can usually find that just with a simple Google search within your state. I think contacting elected officials, bringing it up in passing in Nebraska, and I know it's like this. I wish the councilwoman was still on, because she could probably, talk about how often, she gets just pinged in a social setting or elsewhere about issues, and just reminding them that I always say, it's top of mind. And these are, just really make them think a little bit harder about voting to implement these things, when sometimes, like we started here, they might think it's pretty straightforward. There's a lot of complicating factors there. And for us, I obviously am very sensitive to the consumer impact. The people I represent are really sensitive to that, but also from the business side, it is, it's damaging to our small and medium-sized folks who, again, are already in some ways at a competitive disadvantage. We don't need to do more. So those are my recommendations.
That's great. And Ronza, any other thoughts on how communities who are concerned by delivery fees, or who are sort of more dependent on delivery services, how they can make sure that their representatives understand how important these services are?
Yeah, I absolutely want to ditto everything that Ansley said, but I also want to amplify the part about the contacting elected officials with stories. Ultimately, voters are the most powerful constituency, and telling your story to your legislative body is important. And more than, please don't include these fees in your budget, but why including the fees in the budget would be harmful to you as a voter or as a constituent is really important. Make the human argument. The other thing is pay attention. Pay attention to what the legislative body is doing. In Maryland, the budget bill will be introduced in a couple of weeks. And we've already started the advocacy conversations with members of the legislature to talk to them about how, look, this is a problem if this is in the budget. And we need you to advocate to get it out of the budget before the budget's even introduced, if it's there. And if somebody decided in the middle of the session to try to put it back in, and Maryland has a pretty significant budget deficit this coming year, then we need you to really fight hard to keep it out. So these conversations, and they're easy. It doesn't have to be a formal letter. It doesn't have to be anything that really takes more than a few minutes. You can literally do old school, pick up a phone And you can have your mom in, you know, rural wherever call my child or my son or my cousin, in addition to the actual lived experience of the people that are impacted. If you are an ally or you are a loved one of somebody who's going to be adversely important for lawmakers to hear from you as well.
Absolutely. With that, unfortunately, I think it's time for us to wrap up. So, my fellow panelists, I'm happy to open it up to you if you have any final thoughts or wisdom to share.
No, thank you. We will stay in touch. I'm afraid that this is the conversation that will
Just
continue.
happy for the opportunity. Thanks for being with us.
Absolutely. Yeah. And yeah, to Ansley's point, we don't anticipate this issue going away. And at Chamber of Progress, we're certainly going to continue working on it. And we will continue to be in touch as we see more states begin to consider this. I'd like to thank our audience for joining this afternoon, and I'd like to thank our panelists for an excellent discussion. If you have any questions about delivery fees or for any of our panelists, please feel free to reach out to the Chamber of Progress team, and we'll be happy to assist. With that, I hope everyone enjoys the rest of their week and has a happy holiday season. Thank you.